Ever thought you might not wake up from anesthesia? Is it stopping you from getting that much needed surgery? You're far from alone in these fears. Anesthesia, the state of controlled temporary loss of sensation or awareness, is often shrouded in mystery. It's a world that seems to hold more questions than answers for many of us. What if I told you that much of what we believe about anesthesia stems from common misconceptions and myths? The truth is, anesthesia is a carefully controlled medical practice designed to make surgical procedures safe, painless, and comfortable for patients. It's not a one-size-fits-all approach, but a tailored plan, crafted by highly trained professionals known as anesthesiologists. Despite this, the fear of going under the knife, or more accurately going under anesthesia, is a prevalent one. I'm sure you've heard whispers of the risks associated with anesthesia, the fear of not waking up, of losing your memory, or even feeling pain during surgery. These are all concerns that have crossed our minds at some point. But let me assure you, these are not the realities of anesthesia, but rather myths, born out of misunderstanding and misinformation. Over the next few scenes, we will be debunking these myths, shedding light on the true nature of anesthesia, and hopefully, alleviating some of your fears. Today, we're going to tackle 3 of the most common anesthesia myths. First, the fear that you might not wake up from anesthesia. Second, the notion that anesthesia can lead to memory loss. And third, the belief that you can feel pain during surgery, even under anesthesia. We'll delve into each of these, explaining why they're misconceptions, and what the reality is according to medical science and the experts who administer anesthesia daily. We'll provide you with the facts, straight from the source, and dispel the fear that often surrounds this misunderstood world of anesthesia. Remember, anesthesia is a tool for your comfort and safety during surgery, not a risk to fear. So, stay tuned as we venture into the world of anesthesia, debunking myths and replacing fear with knowledge. The first myth we're tackling is the fear that you might not wake up from anesthesia. It's a common concern, but let's demystify this. Anesthesia is a medical practice that uses drugs to block sensations, making patients unconscious and unable to feel pain during surgical procedures. It's a delicate balance of multiple medications, each tailored to the individual patient's health, age, and the type of surgery being performed. This process is overseen by highly trained anesthesiologists who monitor your vital signs throughout the procedure to ensure everything goes smoothly. So, how likely is it for someone not to wake up from anesthesia? The answer is extremely unlikely. According to the American Society of Anesthesiologists, the risk of dying from anesthesia is less than 1 in 200,000. That's a 0.0005% chance. To put that into perspective, the odds of being struck by lightning in your lifetime are 1 in 15,000, and the odds of getting in a car accident are 1 in 100. So, you're over 1,000 times more likely to get struck by lightning than not wake up from anesthesia, and 2,000 times more likely to be in a car accident. The safety of anesthesia has improved dramatically over the past 50 years, due to advancements in technology, medication, and safety protocols. Today, modern anesthesia is safer than ever before. The risks associated with anesthesia are often related to the type of procedure being performed and the patient's overall health, rather than the anesthesia itself. Of course, like with any medical procedure, there are risks. However, the chances of not waking up from anesthesia are incredibly slim, especially when compared to everyday risks we don't think twice about. So, the next time someone tells you they're scared of not waking up from anesthesia, you can tell them they're more likely to get struck by lightning. It's essential to have a conversation with your healthcare provider to understand the risks and benefits, but remember, anesthesia is a tool that allows life-saving surgeries to take place, and it's safer than you might think. Memory loss is another common fear when it comes to anesthesia, but is there any truth to it? Well, let's clear the air. When you wake up from surgery, you might feel a bit groggy or confused. This is completely normal and is typically due to the residual effects of the anesthesia. You might not remember being moved from the operating room to recovery, or the conversations you had as you were coming around. This isn't memory loss though, it's more like a temporary fog, a short-term disruption to your consciousness. Now some of you might be thinking about post-operative cognitive dysfunction, or POCD. This condition is characterized by a longer-term memory and thinking problems, such as difficulty concentrating, problems with learning and memory, and trouble with coordination and balance. While POCD is more common in older adults and people with pre-existing cognitive issues, it's important to note that it's not a guaranteed side effect of anesthesia. Many factors can contribute to POCD, including the type of surgery, the individual's overall health, and even their level of education. In fact, a comprehensive study published in the British Journal of Anesthesia found that anesthesia itself isn't the direct cause of POCD. Instead, it's more likely due to the overall stress of undergoing surgery and the body's response to it. So, while it's true that some people might experience cognitive changes after surgery, these are usually temporary and improve over time. It's also worth noting that anesthetists are highly trained professionals who work hard to minimize any potential side effects, including memory and cognitive issues. So, what's the takeaway here? It's normal to feel a bit off after surgery, but actual memory loss isn't a typical result of anesthesia. As with any medical procedure, it's important to discuss any concerns with your healthcare provider. They can provide you with accurate information, tailored to your personal health history and situation. So no need to worry about forgetting your favorite moments because of anesthesia. The third myth is perhaps the most terrifying one, the idea that you can feel pain during surgery even under anesthesia. This fear is understandable, but let's delve into the facts to alleviate some of these concerns. Anesthesia is not a one-size-fits-all solution. There are different types, each with a particular purpose. General anesthesia, for instance, is used for major surgeries and makes you completely unconscious. The goal here is to block any awareness, memory, or pain during the procedure. On the other hand, there's regional anesthesia, often used for surgeries on a particular body part. This type numbs only a specific region of your body while you stay awake or lightly sedated. Local anesthesia is another type that numbs a small, specific area for minor procedures. While you're awake, you should not feel any pain at the site of the procedure. Now, the key to ensuring patients don't feel pain during surgery is the expert monitoring by anesthesiologists. These medical professionals are trained to administer the right type and amount of anesthesia, tailored to each patient's needs, health condition, and the nature of the surgery. During the procedure, anesthesiologists use advanced monitoring equipment to track vital signs like heart rate, blood pressure, and oxygen levels. They're like vigilant sentinels, continuously assessing your body's responses and adjusting the anesthesia as required. This careful real-time monitoring helps ensure that you are properly sedated and pain-free throughout the procedure. It's also crucial to understand that the notion of waking up during surgery, known as anesthesia awareness, is extremely rare. It happens in only 1 to 2 out of every 1,000 medical procedures involving general anesthesia, and usually patients report vague, disconnected memories rather than pain. So, while it's natural to fear the unknown, remember that anesthesiologists are there to ensure you have a safe, painless surgical experience. The entire medical team works in concert, like a well-rehearsed orchestra, to ensure your well-being and comfort. Rest assured, your comfort is a top priority for anesthesiologists during any procedure. Now that we've dispelled these common myths about anesthesia, let's recap what we've learned. Firstly, we tackled the unsettling myth that anesthesia could mean you might not wake up. The reality is that modern anesthesia is incredibly safe, with a mortality rate of less than 1 in 200,000. This is thanks to advancements in medical technology and the rigorous training of anesthesiologists. The risk of not waking up from anesthesia is exceedingly low and typically associated with other severe health conditions, not the anesthesia itself. Next, we addressed the fear that anesthesia can lead to memory loss. While some patients may experience temporary confusion or memory issues in the immediate aftermath of surgery, long-term memory loss is not a common side effect. Most patients recover their cognitive functions fully within a few days. Remember, anesthesiologists monitor your vital signs and brain activity throughout the procedure, ensuring your safety. Finally, we debunked the myth that you can feel pain during surgery under anesthesia. Anesthesia works by blocking the nerve signals in your body, which means you can't feel pain during the surgery. An anesthesiologist's job is not only to ensure that you are unconscious, but also that you are comfortable and pain-free during the procedure. In sum, anesthesia is a crucial part of the surgical process that is both safe and highly regulated. Anesthesiologists are highly trained medical professionals who work tirelessly to ensure patient safety and comfort. They monitor your vital signs, adjust your anesthesia as necessary, and are prepared to handle any emergencies that might arise. It's essential to remember that these myths, while pervasive, are not grounded in the realities of modern medicine. Anesthesia has come a long way in the past few decades, and its safety and effectiveness continue to improve. Remember, knowledge is the best way to combat fear. So let's spread the truth about anesthesia and help put people's minds at ease.